Hi there. So, we're on to the sick babies. Now, the eagle-eyed about you will have noticed that this is now Module 3, become 4, become Module 3, and da-da-da. Things get a bit mixed up, but that's the way it is in life, isn't it? I set all this out, well, I discussed this here and this then, but then it sort of gets a bit mixed up. We'll get to it all in the end, don't worry. So I thought actually we would do the sick baby bit now, because it's the last of the not so nice ones. After this, it all gets a little nicer. There's the first one we did, which, well done all of you sticking in there. This is the next one. You only have to hear this once, because once you hear it, it'll be in your head, and that is brilliant. You want to hear it when all things are well, because when stuff goes, I can say something rude there, but when it goes the other way around, you want to be able to know this. So here we go. So this is a baby who's not very well. So number one, you are this child's parent. You know this parent or this child better than anybody else. So when this child stops acting normally, you will be alerted. This is your parent instinct. Listen to it, because somewhere in here we have much more knowledge than we realize we do. So the first thing I say, please, 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 have confidence in yourself and go with your parent instinct. So, first of all, a baby's out of sorts. And we're going to go from that into this sort of three really important ones. There's the meningitis and septicemia, a tough one. We're going to talk about dehydrations, how to know, and thrush, which is another thing we need to know about. So here we go. It's not too bad. Just stick with me. I got a coffee. Maybe you want to go make one. Here we go. Meningitis is number one. Now, for those of you who the mathematically one did all the counting, will know I've been around this block a few times, and I've had an awful lot of young parents, including being one myself. Never, never have I had a case of meningitis. I have had several cases of suspected, and my parents knew what to do, so we were able to stop it. So that's not bad going. You just think about how many babies there are there. So listen, this is important and you will know it. Meningitis starts off like everything else, and now we're going through this COVID thing. We're getting a real breakdown as to how a virus starts. All viruses invade the body and bacteria, because meningitis is often the bacteria. They come in and they invade the body, and the body reacts by having a temperature. Now, a lot of you will get these little cards about what to look for meningitis, and they do things like a rash and a high-pitched cry and depressed fontanelle. We don't want to go that far. We want to catch it long, long, long before that. So everything that's nasty starts out with a bit of a temperature. You're a bit unsettled, not really feeding very well, you're not happy about it, keep an eye on them, check their temperature, use your parents' intuition, check it. So you want to take their temperature. Now, temperature is the key to everything. So here we have our trusty baby again. And this pencil, use your imagination, is one of those probe thermometers. That's all you need. You should all have one of these. They cost about £8 or something in chemist. Nothing to worry about. The actual glass ones, the old-fashioned glass ones, just don't go there. They're awful to read. You'll be, is that, was that? So using your imagination, these ones have a little button. They tell you what normal is. You use it, it goes beep when it's there, and you can see exactly what the temperature is. You write it down and the time. So, how to take your baby's temperature. Babies don't like the temperature being taken, and sick babies like it even less. Obviously, you can't do it in their mouth. Even though this is metal, you cannot put it in their mouth. They're too little, and they're going to resist. So one of the best ways is to put it onto their arm, and this is not working out very well, but cross their arm over like this and cuddle them. They won't like it. The other one is to do it in the crease of the leg, and again cross the leg over, which the baby is resisting, and cuddle them until the thermometer goes beep, and then read it. I have another one here, which is quite a fun one. It's one of these sort of skin proby things. Tells you what it is. Oh, there you go. Tells I'm 36.5. Whatever way around. 36.5. There we go. That should make it. Anyway, so I don't have a temperature. But these are quite good. These sort of proby ones are good. These ones are good. Ear ones, not till they're a bit older. You think of the size of this little mite's ear. You can't put a probe in there. You will do damage. So go for the simple, straightforward ones. So baby's not very happy and you have a bit of a temperature. The normal temperature is about 35.5, 36, and 37's up a little bit. You think, oh, that's not very good. So write it down. Have a little look at that and check it again an hour later. If you go again and it's 37, 37.5, the temperature's going up, not too happy with that. Most people will think it's about time to call the doctor. In actual fact, with an under 3-month-old, the cutoff point is 38. But if you see that temperature going up, call the doctor. Now, under 3 months, we cannot give infant Calpol. Can only be given with medical advice under 3 months. So as well as having a thermometer, you need to have Calpol in the house long before, or, sorry, I'm doing some advertising, infantile Panadol. You know what I mean? Have some in the house so you have it if you ever need it. So you ring the doctor and he'll say, okay, that's going up a bit. I prescribe 2.5 mils, which is half a teaspoon. That's the usual dose. And see how it goes. Now, see how it goes. This is the important. That is not cured. See how it goes. Within an hour, that should have capped it, and then it'll start going down. Or it should be down. It should not be up. So say we've got 38. You give Calpol. It's still at 38. Okay, I'll check it again in half an hour. Fine. Or it's gone up 38.5. 38.5, you are getting worried. This is temperature going up and up. And remember, you check the time. So I'm not happy with this. So say it's 38.5, climbing to 39. Baby's getting fractious. This is time to seek medical help again. Now, most people get into trouble by just ringing once and thinking, oh, it'll be all right. It isn't. The good things are all right, just like a little cold or a little virus, whatever. But the bad things keep going up. So keep an eye on it. Ring 111, duty doctor, whatever again. Tell them what's happening. Now, most of them go, ooh, no, that shouldn't be happening. And they will invite you in. If they don't, go in. You don't have to take their advice. Use your intuition. If you don't like it, you take baby and you go to casualty. And you arrive and you say, these are the magic words. My baby has a high temperature. I suspect meningitis. This will light every red light. Dealing with professionals, you have to use the right words. And this is what all my parents have always done. And they'll go, right, we'll go and check that. And it puts you at the top of the queue. If you just go, oh, I've got a bit of a temperature, they'll stick you in a corner and you may well be forgotten about until things get a bit serious because it gathers very, very quickly. Right? So this is it. Temperature starts to climb. Ring the first line. So that's for us. It's the GP or 111. They will prescribe some medication. Give the medication. Make sure you have it in the house. Give the medication. Check it again. No more than an hour. If it has not capped, going up, ring the doctor again. If it's capped, give it another 15 minutes, half an hour, depending how your baby's acting. Check it again. Record these. If it's still going up, you ring the doctor again. They should invite you in to be seen. If they do not invite you in, get in. When you get there, tell them, I am worried about my baby. The temperature is going up. You see, you've got this. You can show them the evidence. And I'm worried about meningitis, and you will get seen. Okay? These are the magic words you have to work with us professionals, because we can be a bit dim sometimes. So that's meningitis. The next one I'm going to talk about is thrush. Thrush is in the mouth. And a lot of people think, oh, it's just dirtiness gives thrush. No, it isn't. These spores, it's a fungal infection. They're with us all the time. And sometimes, for whatever reason, maybe it's just mouth breathing, the spores sort of dig in and they start. And what you see is on the tongue, you begin to see little white spots. Now, get used to what your baby's tongue looks like. After feeding a baby, they often have a white bit in the middle. That's just little milk fat's still there and they clear. So you get to know your own baby's mouth. If you think it's whiter than usual, just put a clean finger in and swipe it across. The milky stuff will sort of move, thrush really won't. And if you're still not sure, take a photograph of it and do it again in an hour, and you will see it start to build up. And this is thrush. So this you think, aha, thrush. Now this is an amber one, whereas meningitis, red, you know, when you get to it, red, do it. This is amber. Amber says, I've got 4 hours. So if it happens at night, okay, this is not a great thing, so I'll keep feeding baby, I'll give extra fluid, and I'll be first in the surgery in the morning. If it happens in the morning, you ring the doctor and you'll be seen before the end of the day. Key words. Ring up, you will get the secretary who'll go, yeah, you know, see that. No, I am concerned my baby's having difficulty feeding because they won't like feeding because it'll hurt them. And we'll talk about why. You'll know when we do the feeding one, why. They won't enjoy feeding. You say, I'm pretty sure my baby's got thrush, I think it's getting worse, and I'm worried about dehydration. That will light the flags and say, I really feel I have to be seen today. And you will be. Again, it's getting the key words that they're used to, okay? I think my baby's got thrush, it's getting worse, interfering with feeding, and I'm worried about dehydration. That will get you seen. The cure, very easy. All you get is drops, put it in the baby's mouth and it'll clear. If you don't continue with this, because at this stage it's just a bit of an annoyance, if you don't, the thrush will go down the baby's throat into their stomach, and then it goes everywhere, and you have a very, very, very sick baby. Breastfeeders, remember, you will have to get checked as well, because obviously what baby has in the mouth, mum's going to get. So you will need treatment as well. Finally, on this one, we're going to talk about dehydration. Again, this is one of the most dangerous bit. We touched on a little bit with the SIDS because, you know, overheating causes dehydration. We know that. Summer's coming. If I was coming to visit you, I'll be checking the baby, checking the temperature. So many times I've gone to do visits and babies look lovely and they've all dressed them up. And by the time I'm finished, they're just in their vest, but they're a lot happier. So dehydration is something to worry about. And dehydration comes when they're not feeding properly. There's a nice little easy thing to remember. If your baby misses one feed, don't worry about it. Babies miss one feed from time to time. No matter what age they are, no matter how much they're taking. If your baby is 1 week old and they're taking 2 ounces and they miss one feed, that's okay. If they're 7 months old and they're taking 9 ounces or whatever, that's okay. However, if they miss a second one, then you've got to get worried because then you're in danger of dehydration. So that's the first one, missing a second feed. Now, obviously that's just on a straight, everything being equal. If it's very hot weather and if there's a temperature, you will have to move sooner. Babies who get dehydration are not happy babies. Now there are signs and they're not easy for you to see because once I tell you about them, you'll see them every 5 minutes. The fontanelle goes in. We really don't want that to happen. That's when they get very depressed. The eyes look dull, they get lethargic. That's advanced dehydration. We really don't want to get it to that. So if you're worried about your baby getting dehydrated, another thing's vomiting. Before I forget, they may vomit up one meal. That's okay, but they shouldn't vomit up another. So 2 ways of missing it, just refusing it, sleeping through it, whatever, that's not a problem. But if they throw up a meal, go, okay, that's one done. But if they do another one, then you've got a tummy bug and you need to call the doctor, ring 111 and ask for advice, or the doctor's surgery if it's the morning. Another tip here, milk is like blood. It looks a whole lot more. So at some stage, very soon, fill a bottle with about 2 ounces of milk and then just chuck it in the sink and look how far that goes. If necessary, take a photograph of it because you can, oh my God, the baby's been sick. You'll get a much better idea of how much that is. Again, if in doubt, just ring 111 for advice. I know these are difficult times, but the NHS is still open for business and you still have to look after your children. On another bit, we're going to talk just for a little bit of safety, a little bit about handling, because falling, and bumps and things. We don't want these to happen. So very quickly, when you're a very good tip, always hold the opposite limb. You will find this is how all professionals hold babies, is they always hold the opposite arm. See? So if I can get that. So when you've got the baby in the bath, always keep this hand. So no matter how much they wriggle, the neck is always supported and they can't slip away and drown and things. And when you've got a wet baby, opposite limbs every time. That way, and you'll see all of us do that. You will see a health visitor will always look a finger at an opposite limb just in case, because they're very wriggly things. So well done, guys. That's another hard bit done. Now you know what to do if the temperature goes up and up, the key words to say. You know how to look for a thrush, when to do something about it, and you know about dehydration. Anything else, use your parents' instinct. If it feels wrong, it is wrong. Even though it's sort of right and everything else, and you've got this feeling it's not right, just go with it. And if necessary, you take initiative. Get in there, get down there to where they are. But the steps are the duty doctor, 111, casualty. But keep going until you're satisfied. We, as professionals, know what you need to hear. So make us tell you. Okay, look forward to the next one. Bye.